We are back with board-certified neurosurgeon Dr. Jay Jaganathan today talking about spinal tumors. And he brought in a patient, Floyd here, who has a lot of personality. He is one of the strongest guys I've ever met, former MSP. But you started coming down with symptoms. Tell us what you were feeling.
I didn't have stability in my legs. I didn't have the support that I would need to walk. It was awkward, uncomfortable, and I couldn't capsulize what was happening to me. I went to one neurosurgeon, and my ex-girlfriend referred me to Dr. J as a second opinion, and I've been very grateful for my surgical procedure and follow-up.
And how long ago was it that you came to see Dr. J, and then tell us about the procedure that you had?
Okay. Probably around July the 10th or so, I had my visit with Dr. J, and after which he indicated that I needed surgery, which took place July 17th of 2018. Some of the prepping that he did to prepare me was an ultrasound, I think an EKG that we got results from, MRI. I think those are the extents of the various preps for surgery.
Okay. And so then post-surgery, how are you feeling?
I think my surgery went well. My rehab went well. But I think I've got some other issues that may be non-related to Dr. J's surgery on my back. Tried to do sit-ups maybe a little too soon, and that was a little awakening pain, difficulty. But
can't take the power lifter out of you.
Nicely put.
Okay.
Thank you.
And talking to Dr. J now, tell us a little bit about his tumor. There are different kinds of spinal tumors, so kind of run the gamut with us.
Yep, so spinal tumors are tumors that originate in and around the spinal cord, and usually they're classified in three categories. One are tumors that are outside of the spinal cord itself, and almost exclusively those are metastatic tumors that spread from elsewhere in the body. The other type of tumors are tumors that start in the covering of the spine, which is called the dura, and most commonly those are meningiomas and schwannomas, which are normally benign tumors. And finally, there are tumors that are within the spinal cord, such as called astrocytomas and hemangioblastomas. And in all of these cases, they cause symptoms by causing pressure in the spinal cord. And in those kind of cases, these tumors oftentimes can grow, and as they grow larger, they can cause problems with balance and coordination, as you saw in a case like this.
Sure. Can be a pretty serious problem.
It can be, and if you look at the picture here, you can see that the tumor is, if you look at the thoracic spine, the tumor is pushing on the spine, and you can kind of see the normal spinal fluid that's around above and below and how it gets effaced at the spot where the tumor is. And you see when you remove it, the spine is able to re-expand, and the fluid kind of fills that spot. So they can cause serious symptoms.
Sure. And how intense is the treatment, the surgery, and then sometimes radiation's involved as well?
Yeah, depending on the type of tumor, there are a variety of different treatments. Almost always when there's compression being caused, surgery is pretty much the mainstay. For a lot of the benign type of tumors, such as the case here, it can end with surgery if the tumor is taken out. Or for some of the malignant types of tumors, there's oftentimes adjunct treatment, such as radiation, that's required. And that really depends on the specific type of tumor and how resectable it is. Tumors that are a lot of times unresectable, you have to rely on adjunct treatment, such as radiation in many cases.
Sure. Okay. Well, thank you so much, Dr. J. If you want more information about these, you can always head to our website, 9in10news.com. Thank you so much, gentlemen. I appreciate it.
This Health in Focus is a paid segment by Jaganathan Neurosurgery.